Hi, my name's Andrew Grandin. I'm a flight paramedic, EMS educator, and 911 paramedic in central New Jersey. Also a team captain for Team Merit USA. This is my partner, Beth.
Hi, I'm Beth Blizzard. I'm a 911 ground paramedic. I've worked in New Jersey, Pennsylvania, and Virginia. I'm also an EMS educator, and I also compete for Team Merit.
Having the Ventway Sparrow ventilator was a huge advantage for us kind of going into competition as we look to deploy this in the street. These are examples of two of the bags that we carry. This is our traditional ventilator bag that fits many of the traditional turbine and piston-driven ventilators that you guys may be familiar with. It's about 21, 22 pounds when it's fully loaded. And I was carrying both this bag along with this one. We cut down from the full 22 pounds that were in this bag to, the 1 kilo, 2.2 pound Sparrow ventilator. And as you see, as we open this up, you're able to see that we're able to fit all the components that we needed to ventilate an adult, our tubing, our oxygen tubing, the ventilator itself, and along with our oxygen bottle to deploy for simulation. And we didn't have to take anything out of our bags.
Using the Sparrow on an actual patient was also really easy. I used it on a patient in our competition, and I was able to get it on within a couple of seconds. A few things about the Sparrow make it easier than vents that we've had before. Control-wise, it has a single dial that controls most of the settings, and you can see all the settings on this one screen without having to click through any menus or look for things that aren't on that screen, which makes it super easy. It's also easy to set for the patient because it has presets based on patient weight going all the way down to 5 kilos. So it was very easy to program for the patient, and I was able to apply it and have it ventilate the patient very quickly. Working pre-hospitally, I've worked in a system that had oxygen-powered ventilators on the truck, and they were about double the size of the Sparrow. And so they had to be in a separate bag that lived in our passenger compartment. And because of that, a lot of people don't ever take them out of the truck. I've heard from multiple EMTs on cardiac arrest that I was the first medic they'd ever seen use it, which I think is unfortunate. It also, those ventilators have a minimum tidal volume of 400, which is too big for a lot of patients. And they are also not able to ventilate without oxygen. So if you have to switch a regulator, your oxygen dies, anything like that, they stop ventilating immediately and they don't start again. So for a bunch of reasons, I think the Sparrow would be a great pre-hospital ventilator and could work a lot better than oxygen-powered alternatives, which might be cheaper, but don't work as well.
Having a ventilator like Sparrow really shows that excellent medicine we can bring to the patient's bedside. With it being reasonably priced and on the lower end of the price spectrum you would pay for any of the other fully functional turbine or piston-driven ventilators, it is unparalleled, it is unmatched. You're bringing lung protective therapy through ventilation to your patients right there at the bedside. And any patient that is intubated and not in cardiac arrest really should be on a ventilator. Absolutely. Any way that I can get this level of care to my patient's bedside as quickly as possible without risking injury is a win by me.